Well, welcome to this talk, and delighted to welcome back Dr. Michael Cohen. Thank you for coming back, Dr. Cohen. Great to have you again.
Thank you for having me.
First time we talked about vitamin D. Next time we talked about family medicine, and this time we want to talk about iron. Now, why is it important for listeners to know about iron? What is it? What are the main messages to get across here?
Well, I think firstly, iron is involved in a lot of important functions of the body, and it's worthwhile people understanding a few of them, especially in the context of the current pandemic, and also just in general. It's very important for metabolism. It's important for the transport of oxygen from the time it reaches the blood down into the cellular level. It's involved in the synthesis of DNA, the molecule that is responsible for our genetics and also for cellular production. It's involved in what's called the electron transport chain, which is all about getting energy into cells and the use of energy and energy production. So I think primarily the reason that we should be talking about it today is partly because of the immune role. And without going down into the very detailed specifics about how it actually affects the immune system, I think it's worthwhile bringing it up. There's a large number of people in the world who are deficient of iron. It's estimated worldwide to be around 15 to 20%. This happens for many different reasons. I think it's worth going over the reasons briefly. There's, first of all, as with any mineral or element or nutrient in the body, there are different reasons as to why it can be deficient. One is that the person's not getting it in through their diet, or they're not producing it in some way. The next reason would be that it's not being absorbed into the gut, or it's being malabsorbed, so it may be not getting absorbed. Another reason could be because they're using too much of it, so if you're using more of it than you're actually getting in, then you're going to become deficient. And another broad title is actually loss of the mineral. So for example, if someone had a bleeding ulcer in their stomach, or if a woman was having very heavy periods, they'd be losing a lot of iron. And there is also a substantial difference between men and women. So a man typically stores around 1,000 milligrams of iron, which is a gram. And that in a normal situation is thought to be able to last him for a few years, but that's probably because he's always getting iron and losing iron at the same time. So he's got this kind of steady state going on. Women tend to have around 300 milligrams, so substantially less, and that's probably partly because of the menstrual period. And that also has another interesting twist to it, because it may be that as women lose blood, they're also losing other toxins, and which may be the reason why they tend to live longer and be healthier than men. It's just a part of it's certainly out there as a possible theory. I just thought I'd throw that in along the side.
Yeah.
So we've spoken about how iron gets in and how iron may be lost from the body. The importance of iron in the case of immunity is, I can't overstate this. I see so many people who get recurrent infections or even other recurrent illnesses, and very often all I need to do is find out if they've got a mineral or other nutrient deficiency, and very often it's iron. And if I can find out why they've got the deficiency, and if I can correct it, they can correct it, they're on to feeling a lot better, and usually people stop getting ill so often.
Now, I get so many people coming to me saying, I get a cold every few weeks, or I always seem to be ill. And, you obviously think about vitamin D, you think about zinc, but I must say, I haven't really thought about iron. This is really quite a revelation to me. The lack of iron is a common cause of immunodeficiency.
It shouldn't be such big news. We should all be thinking, we should all be aware of it, and should all be thinking about it. One of the problems that I've seen in my job is that we do a blood test, so we look at the levels of hemoglobin. Hemoglobin, if it's normal, and if other what we call indices are normal, so the size of the red cells, we assume that they don't have an iron deficiency or another deficiency. There can be situations whereby you could have a deficiency in one thing and and enough of something else, and it can balance things out enough so that you wouldn't notice it in a normal blood test. And you can also have low iron stores. So there's technically, the blood looks okay when you do a blood picture, but if you look at their stores of iron, the way iron is largely with a protein called ferritin, and when you look at their ferritin levels, their levels are low. And if you do other tests, there's something called transferrin saturations. If you look at that, you can also see low levels. And you wouldn't necessarily pick this up if you just did their blood count and you say, well, you're not anemic, because technically they're not anemic. Their hemoglobin, which is the molecule that we look at and we say this is the main defining feature of an anemia, is normal, and their other indices are normal. But when their body is stressed, and when I say stress, it could be that they are doing a lot of sports. It could also be that they have an infection. It could be that they're just living a very busy life, and so that your body is using up the iron, and it's kind of like going to the supermarket, and on the front shelf you've got all the cans of baked beans that you want, but if you just take out that front shelf, there's nothing behind it. There's no reserve. So they can function, they appear to function normally, they don't look ill, but as soon as their body needs more, the demands go up, they don't have the reserves.
There's no resilience, there's no reserves, there's no fallback position.
And I find very, very often, for so many patients, for so many problems, one of the basic things I will look for is to say, what is their iron level, and a couple of other important nutrients, but this is really one of the central ones. I say, what is their iron level? Have they got the reserves? And if they haven't, I need to find out why, because you don't want to miss an important diagnosis. Many people, it's just because they don't eat red meat or they do a lot of sports. So these are quite benign issues that you can easily correct. But what if they've got a bacteria in their stomach? There's a bacteria called Helicobacter, which can cause malabsorption of various nutrients, including iron. They may have celiac, and celiac disease is something else that also often results in iron deficiency.
It's another autoimmune disease, isn't it?
Yes. They can also have something like pernicious anemia, which is also autoimmune, which also causes, it's typically thought to cause a lack of B12 absorption, but it often goes with iron if you look through the literature.
Is it? Right.
And there may be other things. I mean, rarer things in the West would be having a parasitic infection, but someone may just be bleeding from hemorrhoids, or they may have, in a more concerning situation, they may have a cancer in the bowel or something, which is why there is a cancer screening program for people from 50 and above. But those are some of the things that we need to think about as physicians. And then if we've ruled out anything of concern, we also simultaneously need to treat them.
So there's a reasonable possibility that anyone watching this video, even if they live in what they consider a rich country, even if they have a reasonably good diet, could still be almost subclinically deficient in iron.
Yeah, I mean, I'm not talking about large numbers of the entire, there probably actually is large numbers in the population, but
overall,
percentages of population, it may be a relatively small number. It may be 10% or less. It may be a bit more. I don't have the figures to say how many people have a subclinical iron deficiency, because I imagine it's not very well defined in this sense. We don't go around looking for people with subclinical iron deficiencies. We say this is the level. We say, okay, the lab says ferritin is above 13 or whatever the measure is, and therefore this person is not iron deficient. I think the reality is that there's, like so many things, also like with vitamin D, etc., there's a difference between having a minimum acceptable working level and having an optimal level. So the difference is between someone who technically is well, they don't have any problem, but actually they may have a less than optimal level of something, and that in itself can result in disease. So sorry about that.
No problem. So it's just amazing that even although there's, I think what we're talking about really, there's two things there. There's one thing is that people can be not overtly ill, but somewhat below par.
Mm-hmm.
And then the other thing is the way that the body, even if there is a bit of a deficiency, can compensate so much.
Yes.
That you don't actually realize. I mean, I know I've spent whole chunks of my life, maybe weeks, months, or even maybe a year or more, and you just know you don't feel quite 100%. You still go to work because you always have, and you still do your normal things, but you're just not quite as well as you can be. And you try a few obvious things that you can think of, but I mean, I must say personally, I've never considered that I would be short of iron, because my blood tests always come back that
So, and I don't know if you're short of iron, obviously, without doing such blood tests.
Sure.
But I think it's something that it has a potential to help many different people for many different problems. And so I don't just see it in the role of infections, but I also do see it in so far as even people who have sleep problems, I check them for iron levels. It's well known that there's a syndrome called restless leg syndrome that many people suffer from.
Yeah.
Restless leg syndrome has been known to respond to giving intravenous iron. In my experience, it can also respond to giving oral iron. You don't necessarily have to give someone it through an infusion. This is just one example of something very specific, but it can help with other problems for sure. I've seen people who've got concentration difficulties helped by iron. I've seen people having migraines helped by iron. I've seen people having, well, various things, and I always look for it. I think it's important.
It's so interesting, isn't it? You learn about these sort of stereotypical functions when you do a bit of basic physiology, but yet a particular element is interacting with the totality of the milieu of the physiology that is an individual. Right. And different things are affecting different individuals with completely different unpredictable outcomes. It's just fascinating.
Right. I mean, I think you also need to be aware that it is possible to have too much iron. But I'll give you a little story on the side about iron with a genetic disease called hemochromatosis.
Oh yeah.
Hemochromatosis is a fairly rare genetic disorder, and what it is the body deposits iron into the tissues instead of having enough free iron in the blood, because you need iron to be flowing through the blood. It's taken to various places, and
so these people have got too much free iron floating in the blood. That's the problem.
No, they haven't got enough.
Oh, they haven't got enough iron floating in the blood.
The iron that goes through their blood is actually being deposited in their tissues.
Oh, I see. It's in the tissues, not in the blood. Yep.
And at the time of the Black Plague, the bacteria that caused the plague was something called Yersinia pestis, otherwise the pest. And the interesting thing is that Yersinia very much needs free iron in order to survive and to thrive, and to cause death.
Yeah, got it. Yeah.
When you have this disease, people who had this disease are most likely to have survived the plague better than anybody else, because the bug couldn't take hold and could not actually multiply and infect and make the person ill. So as a result, you have a genetic disorder that resulted in low iron levels in the blood and actually deposition of iron in the tissues. People were not dying young, never mind because of the plague. They died you could live long enough to reproduce.
Yes.
So from an evolution point of view, you were going to live to reproduce, so the genetic mutation stayed in the population. But at the same time, these people survived the plague, and probably resulted in more people with hemochromatosis relative to the overall population surviving this. So this is just a little fun fact on the side. And that's an example where you actually don't want too much iron, because if you're exposed to the plague, though thankfully we're not exposed to many plagues like that.
So Yersinia pestis actually needs free iron.
Yeah.
It almost parasitizes the body for free iron to facilitate infection of the body.
It's just like its food. It needs its feed. Other bacteria also need iron, and it's and we know that when people have probably too much iron, that can also be a problem. So the body is very accurate in the way it regulates iron levels. That it has regulatory mechanisms to make sure that you don't get too little and too much. And sometimes things don't work out that way. They don't. Things do go wrong. So we need to be aware of that as well. But the large part is that people are deficient in iron and not. Either they have sufficient iron or they're deficient. There are not that many people who have too much iron in their blood.
Yeah. Yeah, it's not the most common. It's not the most common problem, or as you say, too much iron in the tissues as a result of hemochromatosis. Is iron deficiency more common in poor areas like African areas, Asian areas, developing country areas?
Yes, it is. I mean, and that's largely because of parasitic worm infections in the gut that basically, they feed on that iron.
Yeah.
And so you're left with a growing worm inside somebody's intestines. The person may not know it. They may have symptoms. They may have abdominal pain. They may have bleeding. They may not. They may have weight loss. And ultimately, they're becoming anemic because this worm is preventing them getting the iron that they need.
So these are actually literally bloodsuckers. It's just that they're inside the body rather than outside the body.
Yeah. They actually latch onto the walls of the intestine.
Is that curable?
Yeah, I mean, there are antibiotics that can cure those, yes. Sometimes they can get very large and they actually need to be removed, but they, in general, can respond to antibiotics.
Yeah.
So
I seem to remember giving out mebendazole in quite large doses in certain circumstances. That, yeah.
Well, we're lucky.
Ivermectin gets rid of worms as well, I believe. On a completely separate issue. So quite common in third world countries, and with the severe anemia that you can get, they're really quite debilitating. I mean, we could be talking about the difference between, the ability to do a day's work and not potentially.
Oh, for sure, yeah.
Yeah. Now, people that you think might be short of iron in your patients, now we're talking about a more advanced country, what lifestyle and dietetic advice will you give them?
Well, first of all, I mean, actually, where I live, we have, I think it's probably the most highly prevalent number of vegans per capita in the world is where I live. And so one of the things I have to do is to try and get people to balance their diet. And very often I have to get people to take iron supplements, which sometimes which often have side effects, actually. But depending on what the supplement is and what the dose is and how they take it, you can try and minimize those side effects. So one of the things that I look for the most is obviously their diet. Are they vegan or are they vegetarian? Vegans and vegetarians have the iron that they get is in the form of what's called non-heme iron, and meat eaters get what's called heme iron, and people who eat meat obviously also eat vegetables, so they get both heme and non-heme. And heme is thought to be absorbed far better than non-heme. But it is possible as a vegetarian to have normal iron levels just with a good varied diet with all the right foods, and that could be fortified cereals. It could be eating plenty of beans and legumes. So that there are things that a person can eat to balance, and people often say, oh, well, of course they're iron deficient because they're vegetarian or they're vegan. What I tend to see is actually there are some people who are either vegan or vegetarian who've got perfectly good iron levels, and sometimes I see meat eaters who haven't. And so again, it's about looking for what is the reason that this person is not absorbing or is using too much iron for their intake.
So if you treat it, are we talking about what, ferrous sulfate tablets or something? Or
there are lots of different types of iron. It comes with ferrous sulfate, ferrous gluconate. Some of the ones that are, one of the ways of improving its absorption is to give it with vitamin C. So vitamin C actually improves the absorption of iron. One of the ways I try to tell people, just have it with a slice of orange or something like that, as opposed to drinking orange juice, because orange juice isn't perhaps the best thing for someone.
No.
And yeah, I mean that's one way of doing it. There's also forms of iron that are sold in liquid sachets, and they are mixed in with vitamin C, and they're a much lower dose of iron per sachet than the tablets. But because they're mixed in with the vitamin C, they seem to be absorbing a smaller amount better than a tablet in larger quantities of iron.
Yeah. And how long would someone need to stay on iron supplements for?
Well, it all depends on what the cause is. So it's important to address the cause. It's important to make sure that if they're bleeding, that the bleeding is you find other ways. Like, for example, a woman who is having menstrual bleeding every month and they're bleeding too much, there are ways of reducing that bleeding, whether it means them going to see their gynecologist or not, whether they need to be put on the pill, whether they need to be checked to find out they haven't got a bleeding polyp or something like that. And also there's a medication that you can give once a month for a day or two at the time of the period that minimizes the amount of bleeding, called tranexamic acid. And by doing that, you're essentially switching off, let's say, the tap. So you're not just, person's not just eating things that contain iron and then losing it through the period so much. And that's also a useful strategy, because a lot of people don't like taking iron. They do get abdominal side effects. They get nausea, they get diarrhea, constipation, abdominal pain. And so if you can find the most gentle way of treating the problem and then maintaining a good iron level, that's usually the best thing to do. And in terms of trying to answer your question, how much, and it's so dependent on each and individual person. You need to see that their levels are going up and that they're maintaining them.
And of course, when you take iron, that's only going to help the red cells that are being produced that day, isn't it? It's not going to like fill up the red cells that were produced 6 weeks ago or something like that. There's a kind of a longitudinal process to.
Well, it gets stored in the liver, it gets stored in the bone marrow, in the spleen, it gets stored in the form of ferritin, which is a protein which it's bound to in the blood. So you are maintaining those stores. So it's important to maintain those stores. When those stores are at capacity or not, they're also interacting and resulting in the production of hemoglobin, which is the molecule which carries the oxygen into cells. So it's not necessarily that the iron goes directly into the hemoglobin at that moment. It all depends on the current steady state of the person's body and their metabolism, and are they in a state of what's called catabolism or anabolism? Are they building cells or are they breaking down? We're all doing that all at the same time, but there are times when someone is very ill, for example, when they're much more in a catabolic state, so they're breaking down stuff, and then there are other times when they're well and they may be doing sports and eating well, they may be in an anabolic stage. So these things make a difference as to the use of iron as well.
So I think lots of people have been aware. I mean, I was certainly obviously aware of anemia and the types of anemia, but the idea of using iron in metabolism, DNA synthesis, cellular activity, and for production of energy in this electron transport chain thing, which I've never fully understood, but I do know it's to do with the production of energy in the mitochondria of the cells.
Yeah.
So it's doing all those things. Now, what about childhood? Are children particularly at risk of iron deficiency?
They tend to be, certainly even in the first year of life. I think a lot of national guidelines involve including extra iron supplements given to a baby for the first year of life, because you're trying to treat, you're not going to start doing blood tests on lots of children.
No.
So and children are not eating much by way of meat, and there is enough evidence to make sure that, because we want to avoid maybe a fairly small population of children becoming iron deficient and therefore having complications as a result of that, there are broad recommendations just to treat every child with a safe dose of iron.
Yeah.
And this is what happens, as far as I know, in a lot of Western countries. It certainly happens where I live. And so iron deficiency is less common probably as a result of that.
And clearly, women, due to menstruation, are at a higher risk. What about older people? Is iron absorbed more slowly when you get into your 60s, 70s, 80s?
I'm not sure. I don't know. I can say that I do see elderly people with iron deficiencies. I don't know if they are absorbing it more poorly. It's quite possible that they do. It would make sense that they may not absorb it just as well, but I don't see it as a big issue. If anything, because they tend to be less, they may be exerting themselves less than a much younger person, even if they've got less being absorbed, they're also not utilizing so much. Therefore, they're less likely to become anemic as a result of that.
Okay. Yeah. There's not the sort of throughput almost, as it were. Yeah. So I've just got a few quick fire questions here. The body can store iron, but relatively small amounts, much smaller than amounts than I had thought, actually. So we could run out of iron over a period of months rather than a period of years.
You can run out of iron very quickly it depends on what you're doing. If you're a very sporty person, you can drop your iron levels, within a matter of weeks.
Right.
If you're not getting it in at the same time.
Yeah. Because I mean, a lot of people know about hemoglobin, which of course is iron in the blood, but myoglobin is the reason that muscle is red, isn't it? So the muscles are metabolizing and using the iron. The iron quite a lot.
Yes.
We've talked about the immunity aspect, which was new to me. That's really interesting. What about iron in pregnancy? Is iron deficiency a problem in pregnancy very often?
So it is, but we should be staying on top of it. So in general, pregnant women are taking supplements, and they often take which contain some iron in it, some elemental iron. And they should be being monitored periodically during the pregnancy. Certainly, if they have clear symptoms of iron deficiency, or if they're just anemic, they will initially become anemic anyway, just because there's a dilutional effect. So they have all this extra fluid on board, and so it seems like they're anemic. Actually, they have the same amount of blood, but the volume of the plasma has gone up, which means that they've got a relative anemia, and that in itself. That's part of the adjustment of pregnancy. That's why in the beginning of the pregnancy, women become a bit breathless in the first trimester, the first 12 weeks, and very often that stabilizes itself. But it is important to make sure they've got good nutrition throughout the pregnancy.
Because in pregnancy, you actually need a larger volume of blood to perfuse the placenta, presumably.
Yes. Yeah.
There's it's as if there's more of the person, really.
Yeah.
So we mentioned the plant and animal derived iron. That's interesting. Liver's particularly high in iron, I seem to remember, isn't it? And of course, there's a tendency not to eat offal in a lot of countries now.
Right. We store iron in our livers as well. We store a fairly significant amount of our iron storages in the liver as well. So it would make sense that that's a source.
Yeah, and I particularly like the idea of taking some orange with your green vegetables to enhance the absorption of the non-heme iron, which is good. Just clarify, please, what do you actually mean when you use the term anemia?
Well, it means that there are certain definitions of what is a normal hemoglobin, and that's based on normal distribution curve in the population, and it's slightly different between men and women. Men have a slightly higher hemoglobin than women do on average, and it also refers to the size and maturity of the cells. So if you have an iron deficiency, you would normally see, first of all, one of the things you see is an increase in the red cell distribution width, which in very simple terms means that normally you have most of the cells are around the same sort of size. And when you have an iron deficiency, because you've got less mature cells and possibly more mature cells, the distribution of that is wider. And so there's a measurement called RDW, which is red cell distribution width. And we can see that when someone's RDW increases, that's one of the signs of a latent anemia, let's say, an anemia that we may not be seeing obvious because they're maintaining normal hemoglobin levels, but they have got other signs in the blood picture that are suggestive of that, of an iron deficiency. If you've got a low average red blood cell size, this is the mean cell volume. This is also one of the signs of an iron deficiency anemia. And there are also other cells that we can see under a microscope called spherocytes, and there are other things that we can see under a microscope that can point towards an iron deficiency.
Yeah, amazing. So many things have to be right to get this basic transport of the oxygen from the lungs to the tissues of the body. It's quite amazing that anyone works normally. Really, there's so many things to get right. So,
And on that point, I think I may have had the spherocyte thing wrong. I know there's something called poikilocytes. There are various cells, and I may
there's a condition called spherocytosis, isn't there? Which is one of the hemolytics. Yeah.
I was getting a little bit confused myself there.
I'm not surprised. There's so many different shapes of cells that you can have. Right, clinically, if someone's very iron deficient, not talking about blood tests. They walk into your surgery. What's going to make you think, oh, this person might be very iron deficient? What sort of clinical picture?
First of all, very often they come in fatigued. They may have hair loss. They may have brittle nails. They may say that their mood is low. They look pale. If I examine them, they look pale. Their pulse may be racing or maybe higher than what I would expect it to be for that person. Those are the kind of signs that we look for. So it's like pale, sullen look on their face. If we look under the eyes of the conjunctiva or at the palm of the hand, we can see that those areas look less well perfused. So we see less blood vessels there. We see less redness in the blood vessels there. So these are all various signs of an anemia.
So that will guide you on to doing some sort of diagnostic test.
Yes.
Yeah. So I've only got 2 questions left, actually. We've done quite well today. What empowering lifestyle advice can we give to people to promote iron health? I think we've kind of talked about that, really, haven't we? It's the awareness and the diet and the supplements if necessary.
And I think also if a person is getting tired, if a person is getting recurrent infections, because this is something I see a lot, people who get recurrent infections, and they always say, oh, I always get ill, and people tend to downplay it. Actually, when you correct it and they stop getting ill, first of all, they stop coming back to see you, which is great. But it's important for their general health and their long-term health. And I'm not talking about flooding them with iron. I'm talking about just making sure that they've got good reserves of iron.
Yeah. And very often, because these things come on slowly, they've got a fairly insidious onset. You don't realize that you're kind of getting a bit worse and a bit worse and a bit worse. And it's only when the problem is corrected, you think, oh, I feel good again. I feel normal again now. You develop awareness into that.
That's also something to say about in terms of mood. So people who just sort of generally feel a little bit off or whatever, and they just assume that it's life and it's tiring and things like this. I saw a chap just today who he's in his early 20s, and he's been my patient for about 10 years, and he's always been a little bit off with these things, and at different times, and he even said to me today, it's like when he actually gets the corrections correct, he feels totally different. He's like, he came this morning bouncing with energy. He says usually it takes him 2 hours to get out of bed, and he said, I wake up now, I get up, and I'm so much more productive. So this is just an example in one particular person, but I can tell you so many stories like that or other versions of that story.
So this guy wouldn't have met the textbook sort of definition of anemic.
No.
But once you restored his normal iron homeostasis, he was just a transformed patient. It's fascinating. Well, you've certainly increased my awareness of iron. I'm going to be thinking about my iron intake quite a lot now, and certainly when people are complaining of constantly feeling unwell and always getting infections, I'm going to say, well, this is an area well worth thinking about, and I'm sure that stimulated thought in many people watching Dr. Cohen. So, once again, for your thoughts on that matter, we're very grateful. We've done vitamin D, we've done iron. I'm sure you'll think of something else, but that's really useful and interesting. So, thank you for your time.
Thank you. Take care.
You too.